Today's topic is about iron deficiency anemia. So, a little bit longer of a video, but we're going to talk about the signs and symptoms associated with it. I'm going to give you about 7 of them. So, here we go. Iron is essential for producing hemoglobin, the protein in red blood cells that transports oxygen throughout the body. Roughly 70% of the body's iron is contained within hemoglobin. When iron intake is too low, the body cannot create enough hemoglobin, so less hemoglobin, less oxygen support to the tissues. Let's talk about these signs. First, fatigue and weakness. Iron helps our blood cells deliver oxygen to our tissues, which provide for the energy that you need to do everything from using your brain to think, to the tiny muscles in your fingers to write or type. Skin changes are the next thing. You can look in the mirror and note the coloring of your skin is lighter or pale looking. Your color isn't as vibrant. This occurs because that decreased hemoglobin, because iron is not there to deliver those blood cells, affects the color or warmth in your skin and mucous membranes. So things look pale. People may also feel short of breath. Less oxygen carrying capacity to the cells can lead to feeling more breathless with activities that are as simple as walking up and down your stairs to the mailbox. In addition to this, the heart can also be affected, and you may feel a rapid heartbeat or palpitations because the heart is attempting to work harder to push the blood flow that you have available to those tissues for oxygenation. Brittle skin or nails is another big thing. Changes in the way your nails look, called koilonychia, a deformity in the nail, can occur due to iron deficiency. Your nail's properties depend on iron. Without it, it cannot make the nail look how it should. Smooth or swollen tongue is next. Your tongue can feel really big, really dry, and swollen, and maybe sore. This is because the lack of oxygen delivery sets off tissue damage and inflammation. Last is probably the one everyone knows about, but they don't understand why it happens. When people eat a lot of ice or crave dirt. Pagophagia, eating the ice, geophagia, eating the dirt, is a behavioral change that occurs due to iron deficiency anemia. Eating the ice is seen as a coping mechanism to increase blood flow to the brain and more alertness and focus. Eating dirt has to do with the response of the system as it tries to combat a nutritional deficit in the body. Nutrition is so important as not all foods are rich in iron, but we've gotten a lot better over the years about it. Some people still need supplements depending on the level of iron in their blood, and others are low enough to require transfusions. Transfusions are also necessary for those that cannot tolerate supplements by mouth, or those supplements are ineffective to bring the iron to the appropriate level for your function. So if you have any of these signs that we've talked about today, you want to make sure that you check in with your physician. So you should be going to get your physicals anyway. But if you aren't, maybe it's time you start so that we can check your blood work and check your iron specifically so that we know what's going on with it and treat it accordingly. So don't let this just linger. If you have these signs, go get checked out.